Quieted down reasonably quick. All right, good morning, everybody. My name is Jamison Bobbin. I'm the board chair for the Economic Alliance. We appreciate you coming out this morning. First off, I'd like to thank Desert Sun again for the coffee. They always keep us hydrated, caffeinated, everything else. Also thank Fort Lewis for hosting us with the Innovation Center. We'll be sending around a sign-up sheet. So if you can take a look, if your name's on it, just sign. If it's not on there, please go to the last page. You can add your contact information. We'll get you onto our distribution list so that you can stay in the know. Anyone here for the first time? All right, we've got a handful. If you all would just mind taking a couple minutes, stand up, introduce yourself, where you're from, who you are. Welcome.
Hi, good morning. My name is Eva Henson, and I'm the new Housing and Innovation Manager for the City of Durango.
No, we got some in the back. All right, Jim.
Good morning. I'm Patrick Sharp. I am the still CEO at University Hospital. So.
Morning, Patrick. I miss anybody? Thought I saw one more hand. Nobody. Okay. All right. We had our board meeting last week. We had a very brief board meeting, frankly, kind of cleaned up some administrative items and then rolled straight into strategic planning. So just some of the highlights from that meeting. We really feel like our strategic initiatives right now are kind of spot on. The ones that we established in October of 2020, those are totally still relevant, probably more so today than what we really realized. But we do feel like we can finally kind of shift out of a little bit of like full-blown recovery reactive mode and step more into kind of strategic planning and then sustainability for the organization. So we're going to look at making a couple shifts organizationally, I think, over the next year. Some of what was discussed is really on the board from a public board member and a private board member, kind of what those roles look like. We're going to, I think, add a little bit more separation and clarity to what we expect and hope to get out of each of those individuals. So that's exciting. We are going to have a follow-up strategic meeting in January or February to just kind of add some more detail to that. But great meeting. Last Friday, we finally got back to hosting our Chairman Circle events. It feels like it's been years, frankly, since we've been able to do that. So we were able to get that group together, thank them for their participation in the Economic Alliance. And then first quarter, second quarter of next year, we'll get back together with that group, really geared far more towards being a strategic partner with those chairman circles. So exciting things going on. We're ready to kind of wrap up this year, move into next year, finalize budgets, transition to 2 new board members. We've got Joe Thine and Steve Elias both joining us. Their terms will start in January. So the Alliance is doing great. We really have had a pretty outstanding year given everything that's going on. And that's attributed to our membership, our partnerships with the city and county municipalities. So we thank you guys. With that, I'll turn it over to our Executive Director, Mike French.
Thank you, James. Good morning, everybody. Good morning. Jamison, it has been like 2 years since we had a Chairman Circle event. So yeah, but it was a great event. Do thank all the Chairman Circle folks who came out. Thank the people at Eolus and the folks at Sutcliffe Vineyards for participating. As Jamison said, we had a business planning event at the back end of the last board meeting. And one of the things that we did is looked critically at our membership And we'll share these statistics in the annual report, which will come out in January. But when we looked at it, there's some clear segmentation, and it begged conversation around what is our value proposition right now across the board to the membership, and is there room for us to have a unique value proposition per segment, and what does that engagement model look like? So it's a really healthy conversation. I think it's going to change the way that we engage, and probably make us a little bit more proactive about how we're engaging. And here you have percentages of our budget from the different levels that we have: Friends, Associate, Investor, and Chairman Circle. The left-hand column, which is graphed here, is the percentage of private membership. And then the right-hand column is the percentage of the whole when we add back in our public partners. Quick membership update: Chairman Circle renewals, Durango Silverton Narrow Gauge Railroad, Investor Durango 9R, Non-Construction Bank of Colorado. We thank all those folks. And at a Friends level, Athena Communications, Brad Blake, SGM, the Levitt Group, Jack Turner, and Four Corners Eye Clinic. And I'd like to specifically call out the Levitt Group. They've helped us tremendously with health insurance benefits. For those of you that don't know, tomorrow is your deadline to get health insurance in for 2022. Quickly, Dan Corman will go over some of these statistics in a lot of detail, but housing data came out, I think, a week ago for November. And the only number, I'm not going to go into this because Dan will, but the only number that was shocking to me, and I think it's the first time ever, and Dan, you can tell us if this is correct or not, but first time ever that single family homes in Durango proper and in La Plata County, so here's La Plata County, both exceeded over $1 million for average sold house, which that kind of blew me away. In terms of how things change so quickly, the last time we were here, we talked about COVID and the transmittal rates and how Colorado was kind of a hotspot in the entire country. I don't think that Colorado's done that much better, but we have a lot of company with many other states. And I'm excited to have Mr. Patrick Sharp here from Centura Mercy. Patrick, thanks for being here. I'm sure everybody wants to hear about it. This is how fast things change. Last time we met, which was mid-October, I don't think Omicron was even on the radar. We certainly didn't talk about it as a variable, and things have changed so fast. So let's see, do I have any other things before I move on, Jameson? Expect the annual report for the Alliance out at the end of January, maybe first week of February. We're already starting to work on that. And as Jameson said, we've had a great year fiscally. We've had a couple of things come in. We were able to qualify for an EDO grant from the state. That certainly helped our financials. All the PPP that we applied for was forgiven, so recognized on our balance sheet. So fiscally, I think we're doing fairly better than expected. Let's put it that way. But I can't thank the membership here enough for getting us through a very difficult year. And I said this to the Chairman's Circle at the end of the event, and I toasted and I said, I'm sure done with 2020 and I'm pretty much done with 2021. So I'm very much looking forward to 2022 and looking forward to engaging with everybody here. With that, I will turn it over to Jameson. Do you want to introduce Chris, or should I just have Chris come up? Mr. Euler?
Morning. Thank you for having me. Appreciate the chance of getting to speak a little bit. I've been telling my team that 2022 is going to be great.
Yes. Yes.
So I'm representing Peak Food and Beverage. The genesis of that, just a brief history, it was Steamworks. We started Steamworks 25 years ago. El Moro is going to be 9 years old. That was our second restaurant this summer. Birds is almost 3 years old this spring. And then recently, we just acquired the Home Slice Pizza restaurants. So that gives us 6 restaurants, 5 pieces of real estate in town now. So we've been able to, I think, get through this pandemic better than most. I've got a great team. We've been very nimble. We've pivoted repeatedly, sometimes on a daily basis, and we've got through it fairly well. Home slice pizza prevails, I like to say. It started about 20 years ago, right after Lynn and Corey's house burned down in the Missionary Ridge fire. Then they started the north location during the 416 fire, and they started the Three Springs location during the pandemic. So if anything can survive, it's home slice of pizza. So that's going to increase our peak food and beverage revenues by about 30%. We're adding 50 employees. I was talking with John when I came in. We're going to have almost 400 employees this summer if we can get hired up to the amount of people that we need. So we're really doing a good job with we're doing our best, I should say, to try to give people what they deserve. We've got a $15 an hour minimum wage, whether they're tipped or not. We've got some enhanced PTO. We're offering health insurance. Anybody that works 130 hours a month on average. I think Mike mentioned the deadline, but we're going to have about 60 people, which is great on health insurance. For a restaurant to have 60 people, I'm really pleased with that. So the nice thing about home slices, I like to say, we're keeping the home in home slice. We kept it here. We kept the ownership local. Well, they could have gone to a larger company and they snapped up this chain and made it part of their own. And we're trying to keep it the way it is. So challenges that we have right now, labor, as you all know, that's been hard across the board for everybody. It's still very challenging, but it's getting a little bit better. The hard thing that we've had to deal with is a lot of overtime just to keep the doors open. And sometimes we've even had to limit hours or limit what we could do with takeout. So that's been really challenging, but it is getting a little bit better. There's a lot of things people think that our restaurants just make money hand over fist. Well, the average profitable restaurant in the United States takes 4% to the bottom line. That's profitable restaurants. So that's not even the ones that are losing money. So it's a challenging business. We are projecting some solid seasonal revenues this winter. Last winter was pretty strong. We had more restrictions as far as the seating and how much we could be open. We think we're going to have a strong winter. The snow that we got last week and the snow is coming now is certainly going to help. Outdoor recreation is really popular right now. People want to be outside during the pandemic as much as possible. So we hope that PERG has a great season, and that usually makes for a great season in town. Mike asked me a little bit about what Alliance investors and friends can do to help restaurants. And the biggest thing I could say is be patient and be kind. Our workforce has gotten younger and less experienced over the last year and a half. Some of them aren't the greatest, but we're training them up as fast as we can. So if you continue to be patient, that would be very helpful to us. Avoid food delivery companies if you can, particularly with independent restaurants. We're not profitable when they do that. And the experiences we've had with them, the quality is pretty horrible. They get there, half the French fries are eaten if they're not just cold, things like that. So please just support your independent restaurants. If you're looking to avoid the crowds because of the pandemic, you can always do gift cards. You could dine during off-peak times, get to go when it's available. That's how you can keep helping our local restaurant scene. So with that, I can answer any questions if anybody has anything. And yeah.
What do you expect as far as ramping up those 50 employees or your employees for the entire peak?
We're getting them assimilated pretty quickly. Yeah, we've kind of identified who could take the lead in certain positions, and we've got them in the fold. They're under our umbrella already and are able to take care of all of or take advantage of all of our benefits. So, anything else?
Are you having problems with housing?
That's certainly a challenge. Part of the issue is, it's one step removed from us, but we know that part of the reason we're not getting a lot of applicants is housing is hard. I know we've got quite a few folks that I hate this, but they live in Aztec and they make the drive up, which isn't optimal, but that's what they can afford. So certainly that's something this community is going to have to grapple with at some point, sooner rather than later, I hope.
How's the food supply chain coming along?
It's still hit and miss. Steamworks been famous for its Cajun boil. We couldn't get crab for a good chunk of the summer. Now crab prices are doubled, so it's just not possible for that to be on the menu. Scallops tripled in price, so we had to take them off the menu at El Moro. Some days, fortunately we got Desert Sun, so we can get all our coffee, but there's some days we're just like, okay, what do? We don't have this today. And again, we just have to pivot and do the best we can. So.
But beer sales are up, right?
Yeah, beer sales have been pretty good, but then there's the can shortage. So it's always something. So Ball Manufacturing, Colorado company, we've always got our cans from them. They just announced that they're not going to do anything less than 5 truckloads, and they won't warehouse your cans anymore. So that puts kind of a small brewers in a tough position with how we can can our beer. So you have to kind of go to a blank can. We have to put a plastic or paper label on it, which isn't optimal for recycling. But again, it's just all these things we got to navigate right now. I never thought I'd manage a restaurant through a pandemic. So we're still dealing with all this, but it's challenging every day. So. Well, thank you for the time this morning. I have to run.
If anybody's tried to make a reservation or eat in town on a Monday or Tuesday, I think these guys, they're about the only show open.
Well, good morning, and thanks for having me. So as I mentioned in the introduction here this morning, I'm Patrick Sharp. I am the new CEO at Mercy Hospital. And I know I've got only about 10 minutes, so I need to stick over here. Okay, thank you. I like to move around, but I won't today. And I know I've only got about 10 minutes. So one of the key things I want to do is, number one, is introduce myself to you and let you know who I am and who my family is. So I came to Durango the end of January of this year. And my wife and 4 children joined me in February. And we are originally from northern Minnesota. So I was president and CEO of an affiliated healthcare system up there with the University of Minnesota and Fairview Health Services. And by the grace of God, we're here and we're loving it. The community has been absolutely wonderful and accepting to us. So just want to let you know a little bit about ourselves and who we are and where we're from. So a couple of things I wanted to kind of hit on, and I know Mike and I talked, and I know first and foremost, probably everybody's in your mind is what's going on with COVID. And, first of all, I want to make the statement, I'm not a physician, I'm not a nurse, but what I can tell you is what I'm seeing on the front lines daily. And that is COVID is not over by any means. And yes, we have a new variant, and so we're getting a lot of questions about that. What's that going to mean? Joe Thai and I, we were talking about this earlier. The N number is so small still that a lot of what we're seeing and talking about is, I would say, trends, but we still got to wait to see where it's going to play out. Now, there are a number of studies that have started to come out about this new variant. The things that we are speculating, and I think we have directional data on, is that it likely is going to be more infectious. However, to this point, and I caution to this point, because again, the N number is very small, is that the symptoms do not seem to be as severe that we've been seeing with the Delta variant. Now, the key message that I want to say is that we still know that vaccinations and boosters are your probably number one defense from getting extremely ill. So I just want to put that out there. Obviously, proper hand washing, all the things that we've been hearing about really have not changed. We still need to be cautious about that. If you're sick, making sure you're staying home, getting tested, all those things. That's the biggest thing that I can tell you about this new variant, and we'll see where it's at. Now, directionally, I was in a meeting just last week. We look at the Delta variant. positivity infection rate we see starting to kind of dip a little bit. However, the big question out there is what's going to happen after the holidays, right? Human nature is we come together, we start to congregate more, we're inside, and so we'll have to kind of wait and see where that all that plays out. From a hospital perspective, all I can say is that if you know any healthcare workers on the front line, pat them on the back. You know, when we walk through the hospital every day, the reality of it is, and we're not going to hide it, is people are tired, they're burned out, but they are doing a phenomenal job taking care of the patients in our community here. Our census continues to be high. We have days where we'll get moments of reprieve, but very quickly we see people back in again. And again, I could tell you directionally, statistically, if we look at the people, not just in our hospital, but in Colorado and across the nation, the trend still shows that the majority, there's always exceptions, but the majority of the people who are being ventilated and who are extremely ill are unvaccinated. So that is what we know. It does not mean that there's not breakthrough cases. That does not mean that, you might get some, one-offs, but I say that just to reinforce what we're hearing in our public health community across the nation is that the vaccination does help, it does work, and it continues to be one of our number one defenses. So I know I'm running out a little bit of time here, but so just want to kind of level set with that. And again, I can't stress enough. If you know somebody who's working on the front lines, pat them on the back, say thank you. Help them out if you know they need some help, because they are working long hours, and their commitment and dedication to this community is just unbelievable. I've been humbled by it as a new CEO here. A couple things I want to address too. I know it's the elephant in the room, and I'm sure many of you've seen the messages that have kind of played out in the Herald about where Centura and Mercy are sitting. Kind of want to address some of those things. There's the notion or the idea that we've got a mass exodus of employees. And what I will tell you is that we are seeing, just as much as many other industries are, what we call the Great Resignation. When we look at healthcare in general, we are seeing through COVID, having almost been 2 years in COVID now, certainly there are great pressures on the people who are working in healthcare. And one of the biggest areas is nursing. And that has changed the economics of that. It has changed the supply demand of nurses. Mercy's not unique to that. And for some of you who may have seen some of the articles, one of the things that I have mentioned, I've come from rural healthcare. The challenges of rural healthcare, whether we're in a pandemic or not in a pandemic, are always there, right? People will ask me, well, it's got to be really easy to recruit physicians to Durango. And I've been here for almost a year, and I'll tell you, it was easier for me to recruit primary care physicians to northern Minnesota, where it can be 40 below. In large part was for those that loved that rural lifestyle, they were able to achieve it, but they were also able to go up there and buy 80 acres for a fraction of the price of what we're having here for housing. So those are just some of the dynamics that we see. I give this as a great example, partially twofold. Let people know that we are working. I'm hearing the community. I hear what people are saying, that we need to have more access in primary care, in cardiology and oncology. And that is many of the areas that we're continuing to push on and focus on. But a great example is, and I share this, about 2 months ago, we were this close to signing another cardiologist here to our market into Mercy. He was all set. We were finalizing term sheets of employment agreement, and his significant other, his girlfriend at the time, which, their relationship was progressing, he was coming out of fellowship, said to him one weekend, you know what, I got to be honest with you. I just don't see us staying long haul in Durango. I want something bigger. I want more of the metropolitan feel. And he pulled out right at the last minute. And so those are some of the challenges that we continue to deal with here in a rural area. And it's not unique. It is not unique to Durango. It's something I dealt with again in Minnesota. But again, doesn't mean that we're not going to continue to work hard and find those right people. because when we recruit, it's not just the clinical fit. We got to make sure that we have the right community fit too, right? We want people entering the community that are not only going to practice medicine, but also do all the things that we're talking about. They're going to feel like they can thrive. You know, I've kind of jokingly said, if I can't find it on Main Street in Durango, I probably don't need it, right? That's my viewpoint, the world. That's not other people's viewpoints. And so we have to make sure we lead through that. Also want to just highlight some great things that are going on. Unfortunately, I don't know if it's been in the local news here, but last week it was announced through Leapfrog. Leapfrog is a independent kind of watchdog of hospitals' quality and safety. But Mercy was given an A rating again, but we also received the accolades of being one of the top 23 rural hospitals in the nation. And we continue to be a 5-star CMS hospital too. So that does not negate that we have some areas to work on, right? We got to continue to work on access, continue to work on that patient experience on the front end. Primary care is a top priority for me because to me, that's the funnel, right? That's where we need to make sure that we're meeting people's needs at the basic aspects. But I also wanted to share with you again, the great work and that to get that rating, that again is a testament to the people, to the nurses, the frontline workers, the physicians, the nurses, the APPs that are coming every day to Mercy and staying dedicated even through almost 2 years of a pandemic. And so just want to call that out again, that it's just outstanding work. I'm going to pause. Any questions for me? I know I'm running out of time and first and foremost, please, if talk to me outside of here. Hopefully I'll be back again and we can talk more, but any questions at this point this morning that I can help answer? Any concerns that you want me to be aware of?
Yeah, could you talk a little bit more about the cardiology side? I know that Mercy had a pretty strong practice that is, less in terms of your doctors and stuff like that. Maybe just talk a little bit about that.
Absolutely. Yeah, so cardiology is one of the top, I'd say 4 that we are recruiting for, continue to recruit. Now we've been able to bring in some more and starting to stabilize that a little bit more. We are currently still in the process of trying to recruit at least 1 or 2 more to that area. Again, cardiology, like a lot of those areas, again, from a rural perspective, first and foremost, you narrow your pool down right away from people who want to move to a rural area. And a lot of times when a physician is leaving fellowship, statistically, they stay in a pretty decent sized radius around where they did the fellowship, right? They've kind of established life. They may have a significant other, they may have family there. So we're trying to draw them out to the rural area. The other aspect that makes it challenging for those subspecialties is that if I'm a cardiologist coming out of training and I can go to a rural area and they say, guess what? There's 4 of them. That's what we can support. So you're going to be one of 4. And oh, by the way, cardiology is one of those services that requires call coverage for the hospital. So I can be one of 4, or I can go to Denver and be part of a private group where there might be 10. And so those are the style of life and things that we have to deal with and challenge with that, because again, a smaller population market can only support so many cardiologists, right? Because they're going to come in and be like, okay, what's the population base I'm dealing with? Whereas I can go to Denver. So those are just some of the challenges. However, they are out there, right? It just takes a little bit more rolling up the sleeves and working. But we also not only have to recruit the physician, we have to recruit their family. And that's key. And so people have asked me from the business community, what can you do to help? It's just that, we're working on looking at the model of how we recruit. And one of the things that we did up in Minnesota that worked really well is that when we brought a recruit in and their significant other, making immediate connections into the business community and the social networks are so important, because if that doesn't happen, often the physician, the husband or the wife, whoever it is who's the physician, they're meeting their professional needs, they're meeting their social needs, they're getting adult contact every day, and the significant other who might be raising kids or not, all of a sudden they're starting to feel like there's an isolation, and within a year or 2 they say, you know what, I want to go. And one of the realities that we're dealing with, and I've shared this with people and they've said, well, I don't like that. And I'm like, I don't like it either, but it's the reality. The advisory board, which is out of Washington, they are a think tank advisory, they're a consulting group, pretty high powered consulting group that does a lot of studies and data. The generation has changed in the workforce, not just in healthcare, but long gone is the day that, you know, you come in, you get that first job and your goal is to get that 30-year Rolex at your 30-year anniversary. Those days they're gone. I'm not saying there's not some of that, but we're seeing that in the physician market too. Statistics will show that that first job out of residency or fellowship, and this is independent of rural or urban, is that in 3 to 5 years, they're moving to the next job. And so when we are recruiting, we have to keep that in mind. We have to think about the fact that, you know, if I can get another medical oncologist and they're going to be here for 5 years, the sad part of it is that's a win. So we got to grab that and just realize that there is a perpetual recruitment cycle that has to be occurring. It doesn't stop. You're always thinking ahead because you're going to have retirements. You're going to have people that are going to say, you know what, I've been working a 1.0 FTE for 15 years. And we're seeing this with COVID. And I'm not saying it's a bad thing. People are making lifestyle changes. People are waking up and kind of saying, wow, you know what? I remember when my child was born and they're now 16 years old and I can't remember where those 16 years went. I want to slow down in my professional career and devote time. And so then they want to lower their FTEs. So we always have to be reminding ourselves that this is a perpetual force that we need to be working on, because the dynamics are always changing and shifting, and even the population growth right here in the Durango area. So thank you for that question. So I know I'm beyond my time. Can I take one more if anybody?
I got a question. We all know health insurance is very expensive here in that area. What percentage of the uninsured population do you see on average?
I don't know the exact number, but a pretty large portion. So there are other independent providers in our market, obviously. That is one of the benefits of being part of a larger system, and we are a faith-based system, so we take all comers. It doesn't matter what your economic status is, we're going to take care of you. So because of that simple nature, we do see a higher level of what I call government payer or uninsured. I would say most people are going to fall in that Medicaid, range. But if we were to combine Medicare, Medicaid, we're pushing high 60s%, maybe even close to 70 at times, depending on which service area or which service line, in terms of what we're seeing for our payer mix. So it's a significant amount. So. Wonderful. Well, thank you. And please feel free to reach out to me. Okay?
Dan Corman.
Everything's going great. Good morning. So it's no surprise to see some of these numbers. You've been hearing it all year. I mean, even at the beginning of the pandemic, things kind of went down in April of 2020 and then all of a sudden shot up in May. And so things have been strange, to say the least. And so with monthly statistics, it's actually the exciting stuff, okay? You're gonna see some of these numbers and be mind blown by it because there are outliers, there are small sample sizes in these monthly statistics, whereas next month, when I come up here and talk about the year end, we'll be going on a 12-month rolling average, which will smooth a lot of these numbers out. But November is a little weird. So Durango and La Plata County have the same average price of over $1 million. And that is unsustainable, right? If you looked at the La Plata County statistics, though, as you know, they had a bunch of different data on that released by CAR. When you look at year to date, that comes down to 7, still really high. Okay, it's still an unattainable purchase price for many of the people working in this county. So I just want to hit a couple of the high levels, and then I'm going to also show you a couple graphs because numbers, you go cross-eyed. But ultimately, new listings in November in town Durango, 5 houses. 5. Okay, it's not a lot of inventory. New listings in the entire county for single-family homes. This isn't including townhomes and condos, but 32. That's Bayfield, Ignacio, Durango. Not a lot of houses. And both of those numbers are down significantly. When you look at Bayfield, same thing going on. It's okay, we can stay on this graph. It's just the same thing, new listing 6. So statistically, these are seasonal oscillations. So when you look at this graph, you can see the peaks in June to September and the troughs in the winter. If you take a look at, and I'm not sure why my data point's off like that, but at the top of the market in September of 2019, pre-pandemic, we had more active listings on the market since 2014. It was a great time to buy. Hindsight's 2020. I'm depressed too. It's just like, oh my God, what? So we went from 567 houses on the market to today's number of 104. So we're at 20% of pre-pandemic levels. If you look at Durango in town, we're at 8 active houses, and today it's 6, and it might even be 5 today. John probably sold one already. But that is 6% of the housing stock pre-pandemic, 6%. And so if you know a developer, if you know somebody in the city, please tell them to get creative. I think that's why she was hired. And remind me of your name. I believe that's why Eva was hired. Because goodness, we need to build units. Next slide, please. So that was looking out over from 2009 until today. When you just look at the last 3 years, pricing is, just look at the stacking. You can see it's visual. You see it. It's 2x what we were in 2019. And that's all I got. And then when you extrapolate that back out to 2009 and you look at the number of units sold, the units sold are actually still breaking records. We're still doing more business and selling more homes than we did ever before. We're even in the county. We're up 38.5% in November for single family home sales in town Durango. So we sold 3x the inventory. Okay, there were 18 homes sold in Durango, but we only have 6 at the end of November. And that math doesn't compute, does it? It's because as soon as things are hitting, they're going off market. They go on market, they go off market. And that's hyperbole. Some houses still sit for 15 days, which is now an eternity on the market, which means you're overpriced. But the big story here is inventory. Demand is high. We have been found, but we have always been sort of found. It's always like, let me in, but nobody else. And it's time to figure out the inventory problem. And I'm, I think we've heard from some of the city representatives stating that there's 1,100 projects in queue for planning, but that does not correlate to actual houses. So again, talk to your friends. Let's get some houses built. Thank you for your time. I'll take questions after.
Chuck Stevens.
I'm laughing. I don't even know where you had that picture. When did I last wear a tie? I think I wore a tie once in La Plata County. It was that day. It was the day they hired me for this job. I'm Chuck Stevens. I'm the county manager for La Plata County. Thank you for having me. It's been, I'm sorry. It's been way too long since I've been here. I think it was 3 years ago was the last time I spoke. So hopefully we can change that up a little bit. I was invited here to speak, I think, to one specific topic. But before I do that, I just wanted to take a moment to recognize that we're in the Innovation Center. And when Chris was talking earlier about how Peak has to pivot and be flexible and adjust and make changes on the fly for the pandemic, I know that people often don't equate local government with having to do those kinds of things, but we had to do those kinds of things too. And I'm really proud of our team. We're about 420 full-time employees at La Plata County. And we had to do all of those things just like all of the businesses in town. And actually our innovation program at La Plata County has been in place since 2016. September of 16. And I'm incredibly proud of it. And I would welcome the opportunity to come back at a different time and talk to you about what we do internally for process improvement and for innovation from a local government perspective, because I think it's a little bit different, but not too far away from what all of you are doing every single day. So with that said, I was asked to come here today to talk a little bit about the land use code and the planning process. I think most of you know that for a number of years, starting really in 2016 and 17, the county underwent a process to completely rewrite the land use code. And this is the part of the county code that directs development within the county. There was an initiative early on, and the county proposed, based on feedback, a lot of it from this group, that developers needed more certainty and predictability if they were going to develop effectively and efficiently in La Plata County. Because frankly, the old code didn't allow for that. It really didn't. It was broken, and we acknowledged that. And so as county staff, we looked at it and said, okay, well, if you want certainty and predictability and you want to move fast through land use and development, what we need to do, the best tool for that across the nation, is to go to traditional Euclidean zoning. So you take the map of the county and you draw lines on it and boxes, and you say, this is zoned for residential, and this is zoned for commercial, or this is zoned for mixed use. So it's residential and commercial. And then a developer can look at your map and say, okay, I see property, I see it's already zoned for what my vision is, and I know that I can do that there, and I'm going to streamline the process. So the county rolled out a proposal in 2018, late 17, early 18, that tried to introduce Euclidean zoning into La Plata County, and it was not well received. Okay, I'll just be blunt about that. We had a lot of people show up at the fairgrounds one February evening to tell us just how it was not well received. Okay, and they told us very clearly that this community did not want traditional Euclidean zoning. They didn't want it. Okay, so the other end of that continuum, the other end of the spectrum, if you have certainty and predictability on one end, what's the other end? Well, the other end is we want to be able to do all things anywhere. Okay, but we want the neighborhoods, we want the residents in the districts, the planning districts throughout the county, we want them to be able to look at a project, a proposed project, and say, yeah, that's compatible with our district, that's compatible with our neighborhood, we want that kind of project here. Okay, but that's a very slow process, because now you have to introduce more public meetings, you've got to do outreach to the districts and to the neighbors to find out, hey, here's your proposed project, is it compatible with what your district values? And so that was a challenge for us, but the board gave us guidance. They said, okay, we're not going to go with traditional Euclidean zoning. What can we do within our code to streamline, improve process, make things go faster? And so that's what we set out to do. We rewrote the code from scratch. We did it in-house. We used our own planners, we used our own attorneys. And I only highlight that because that just doesn't happen. I mean, I would defy anyone to go find another community, municipality, or a county that wrote their own code in-house. But that was very important to our citizens. They didn't want someone coming from out of state or from out of the area to tell us, how we should be doing development within La Plata County. So we did it in-house. And the board gave us very clear guidance. They said, you've got to clean this up. It's got to go faster. We've got to improve process. We've got to make it easier for developers to build the houses that we need. Okay. So we tried to introduce a couple of tools within the code. The first thing we wanted to do was we wanted to move projects from being what was referred to as a Class 2 permit. And even the term didn't make sense to someone. If you're a developer and you're looking at the old La Plata County code and you're like, what is a Class 2? I don't even know what that is. What's Class 1? Which one's easier? Which one's harder? Which one's faster? You didn't know. So just even changing terminology was one of the things we did. The old code didn't even have a table of content. So if you were a developer coming to La Plata County, you didn't even know, you'd open the book and you didn't even know where to go because there wasn't even a table of contents. So we added one. And then we tried to change terminology to be more consistent with land use planning across the state and across the nation. So now we have a major permit that's the equivalent of what was a Class 2, and we have a minor permit, which was equivalent to something else in the code. And those are a little more intuitive. A minor permit probably doesn't require as much of me as a developer as a major permit. So we tried to do some things to clean things up, but what we really tried to do was to move those applications faster through the process. So what's now a major project, we wanted to eliminate those to the greatest extent that we could. We wanted to move majors into minor, and we wanted to move minor into administrative review, and we wanted to move administrative review down to something called director determination. And as you go down the hierarchy, director determination is the fastest. So we tried to think, okay, what kinds of projects can we create or nest under director determination? We want as many as possible under director determination because those are going to be the fastest. And then if it's a little more complicated, it's an administrative review. What can we put in there? And then if it's a minor permit, that requires at least one hearing with our planning commission. And if it's a major permit, well, now that's the full Monty. So now you've got, everybody's involved, the planning commission and the board of county commissioners. So that's going to take the longest time. So that was one thing that we did, was we were very deliberate and very thoughtful in how we tried to craft that. And we tried to move as many potential projects as possible down the hierarchy so that they would go faster through our process. So we're a year later now. The board actually adopted the code on September 15th of last year. It became effective on October 1st of last year. And so it's been just over a year. So one of the things that we committed to and told the community we would do, because there was a lot of concern about, this was a pretty major overhaul. This was a lot of changes. And people, I think, and rightfully so, were a little concerned about how it was going to go. And they wanted assurances from the county that it wasn't going to be another 20, 25 years before we updated this code if there were problems. And that's literally how long it was that we were living under this old code that had been patched and repaired so many times that it was just really on life support and was broken. And so we said, we're not going to do that. In fact, the Alliance was very interested in that and came and spoke to the Board of County Commissioners at one point to say, it's going to be really important to earn the trust of the community that you commit to a transparent process for how we're going to review and ensure that the code is doing what we intended it to do. Okay, so we're a year into our new code now, and our planning department has started pulling statistics. So we've taken all the data from October of 19 to 20, so old code, 12-month period, and we've collected the data from the same period from 20 to 21. So we've got hard numbers. And what we're doing right now is we're doing the analysis. So we're trying to find those analogous relationships. Okay, what was an apples to apples comparison? What was a class 2 permit? How many of them did we have? How long did it take to process? And then of those projects, which ones came over and were major permits? And how long, how many and how long did it take to process? So we're doing that analysis now. Okay, that's the quantifiable piece. And I'll tell you, I've looked at the numbers and we've still got a lot of critical thinking that we've got to do on it. But I am seeing exactly what we wanted. We're seeing fewer majors. We're seeing, fewer minors, but we're seeing a lot more administrative and a lot more director determinations. Okay, that was the intent. Okay, we've still got to peel it back a little bit more to make sure that because sometimes numbers can be misleading. We want to be very, very, very deliberate in how we look at these numbers before we roll them out. Okay, that's the quantifiable side. The other piece of that is what's the more subjective side? Okay, so we've prepared a survey that's going out to people that have applied and have taken processes through the new code in that year. And we're asking them for their experience. What was their user experience? What was it like from your perspective going through the land use process? Did it get better? Was it cleaner? Was it easier? Was it more efficient? Was it easier to understand? Ideally, if we get lucky, we'll find a handful of people that actually have done projects with the old code and the new code, because their opinions would be really informative for us. Okay, so that's where we are with the code right now. Let me pause there maybe and take some questions. And then if there's nothing on land use planning, I have a whole litany of county topics that I could throw out there if anybody wants to talk about. I don't know. Yes, sir.
Influx of housing permits come through?
influx for not major development, but our single-family residences we're definitely up, year over year. I get a monthly report. I don't have the hard numbers for me. I could certainly provide it to you if you give me a card. But yeah, we're definitely up on total permits issued this year over last year. We're definitely up on valuation over last year, and we're way up on inspections. So our building inspectors getting out there and inspecting new construction. Mhm. Let me check my notes too. Maybe I forgot something. Jasper? No? Okay, you look like, and I could always count on you for something, I'm sure. Oh, okay, so we also committed to doing updates. In fact, today at 10 o'clock this morning, Board of County Commissioners is going to hear the first proposed code amendment to our brand new code. Okay, because as we were going through it, we've uncovered some unintended consequences. I mean, we've got some language in there that, as that first project came through, we're like, wait a minute, this doesn't work. This doesn't make sense. And so we're getting those teed up for the board literally this morning, 10 o'clock this morning. The board is going to hear proposed code amendments. They're going to hear them today and then be asked to take action on them on January 4th. So that's happening. Those proposed amendments have already gone through our planning commission and now they're making its way through. So we are trying to get in the habit of being more responsive and trying to fix things. And for example, one of the changes that the board will consider is the requirement to prove water. Proving water for land use development can be very time consuming and very expensive. But we live in La Plata County, and it's really important that if you're going to have a land use project, we got to be able to prove water, not only paper water. Sometimes we make you require wet water, which means sometimes it requires a well test. Okay. We had an application for a storage unit come through. Well, they have no water demand, and we were making them prove water. And that didn't make sense to us. And so that's one of the first changes that we're bringing to the board today is, hey, we missed this. It never crossed our mind that there could be a land use, project that was going to come through that wasn't going to require water. We live in a water critical county. Water is always on our minds. We always want people to prove water. Well, maybe not always. So we're going to talk about that today. Yes, sir. Jasper. There he is.
The question I was thinking of is on the La Posta Road, maybe we comment on that. The Alliance is working on that, the city's been working on the county, and maybe just where your perspective is on.
So we know La Posta Road is a prime area for development. We know that and has been for years. And we've heard from this community especially that we've got to do some, local government has to do something to break down barriers to development on La Posta Road. We know that. 2 years ago, the county put a line item in our budget. I won't get into county budgeting, but the bottom line is if I don't have a line item in the budget and a commissioner comes to me and says, hey, I want to spend money over here and it's not in my budget, you have to wait a whole year budget cycle before we can do anything with that. So 2 years ago, we put a line item in the budget for La Posta Road development. I believe it's $2.5 million. We didn't spend it. We didn't spend it last year. And guess what? It just got adopted and it's in the budget for 2022. The reason it's there is because when the opportunity presents itself, I want the ability to act quickly and say, yep, we've got a line item in the budget. I've got $2.5 million. What do you need the county to do? We're ready to execute. Okay, so that's our level of commitment and we're ready to go. But the better news on La Posta is the American Rescue Plan Act and the infrastructure bill. Because now we're still waiting to read the fine details of the infrastructure bill to see how those dollars can be applied and where they can be applied and what the rules are around them. But the American Rescue Plan Act specifically calls out one of the authorized expenditures for those funds. It specifically calls out infrastructure projects, water, sewer, and broadband. Well, water and sewer are two of the biggest barriers at La Posta. So that's been on the minds of the county commissioners since April of this year when we had the board retreat. And so La Posta is always top of mind for La Plata County. We're constantly working with City of Durango. And I talk to Jose about this all the time and his community development team is always talking about it. As soon as we can find the right bucket of dollars and find the right project, I think for the first time, maybe in a very long time, local government is ready to act quickly and respond, and we've got money set aside for it. Oh, yes, the county treasurer. Hi, Allison.
I'm going to follow up on Jasper and La Posta Road. It's like, can you give an update
Not to a great extent. I know that last week the board signed the TIF agreement, which is the tax increment financing. I know that the URA is the City of Durango initiative. County has a seat at the table just by state law. We have a seat at the table on that. So we have a representative on the URA board. I know the URA has identified at least their first area to improve, and they refer to it as the Midtown District, and I don't know exactly the boundaries of it. I know it includes some of our property over the old main post office on 11th. So, and I think the town center where Oscars and Craigers is located and City Market. So I know they've identified the first area, and I know that the paperwork is following. Like I said, the board just approved the final agreement that we needed to approve from the county's perspective last Tuesday. But beyond that, Allison, I'd have to dig a little deeper and get back with you. Okay.
I think as the Alliance knows, and one of our biggest initiatives and one thing that Mike has been outstanding about is public-private partnerships. So to hear that, you know, our municipalities have line item budgets to help from an infrastructure standpoint, to get ground shovel ready, to bring more units, more commercial onto the market, I think is a tremendous win. So thank you guys. We'll continue to be a voice for the business community and encourage that. We'll move into municipality updates, and we've got like 60 seconds. So everybody's gonna have to talk really fast. Who do we want to go to first? Sharon.
Good morning from Ignacio. I'll go as fast as I can. Last night we adopted our 2022 budget. We're in a really strong position from 2021, and we're looking at a conservative 2022, but still very, very strong. We will take up our land use code back up in the new year and work on that and make sure we get it right. And next week, we have a project kickoff meeting with the CU Technical Assistance Group, looking at some downtown revitalization for our community. And if you missed it, we had the most amazing light parade. We had 28 entries in that parade. And thanks to Alpine Helitours, Santa flew in on a helicopter. So just an exciting time in Ignacio. Thank you.
You get more Christmas spirit, right? So he doesn't have to use the helicopter. Mayor Tarkington from Bayfield.
Hello, everybody. It is dumping right now here in Bayfield. This was such a great lineup today. Just want to thank all of our speakers. This was a really good meeting. Just real quick, our board meetings have been filled with public hearings about the various annexation requests coming our way. Tonight, we have a public hearing for a proposed annexation for a tiny home village. 6:30 at Town Hall is a pretty interesting project. If anybody from the community would like to join us. I feel that the sentiment of the board will be to approve all of these annexation requests that have come our way. And I will keep everyone posted on the wheres and whens of these projects going forward. But yeah, thank you.
Super. Thank you, Mayor Tarkington. And Mayor Kim Baxter. We have Mayor Baxter on. Okay. Oh, we've got a
Tommy Crosby, City of Durango. Few quick updates. So regarding downtown's next step, the process of kind of visioning for North Main, the feedback process for that has started. Our first survey is being sent out this Friday. Not the best timing. It will be open from this Friday to the 7th of January over the holidays. Please, please, please fill that out. Share with your networks, business owners, community members. It's the first step in this pretty expedited feedback gathering process that will start now till the end of March. We'll be sending that out as much as possible. So if you see it, take it and share it. Quick La Posta Road update. There's a property owners meeting this Thursday with the city, the county, the Economic Development Alliance, the Urban Renewal Authority, and property owners to discuss the annexation of 320 acres in the La Posta area. Just to touch on someone's URA question, we are trying to bake in that URA aspect of the possible La Posta annexation and expansion from the very beginning. To follow up on kind of URA updates, we are offering in our Midtown URA zone, which Chuck described pretty well. It goes kind of from the river crossing by the VFW down to Natural Grocers, up to kind of the police department, and then back to the river up Second. That's kind of the Midtown area. In 2022, we're going to be offering 3 grants for property owners of up to $50,000 for projects that are focused on property improvements, addressing some of those blighting factors that makes an area eligible for URA designation. We're trying to leave this grant very open to ideas. So really the focus is improving property value, whatever that may look like for you. If you have any questions, please, I'd be more than happy to chat about that. We're encouraging matching funds, and we're encouraging larger scale projects. Lastly, regarding the URA, we're in the process of trying to move forward with another URA area on North Main that goes from 35th down to 32nd, kind of anchored by a 22 unit housing project, I believe it's on 32nd and East 2nd. That will hopefully be moving along very quickly because we're trying to work with that developer to get those units up and going as quickly as possible. If you have any questions about URA, anything of the sort, feel free to grab me.
Super, thank you.
I just want to make a clarification on the Posta landowners meeting. Thank you, Tony, for mentioning that. On the 16th, so it's Thursday, it's not an official community meeting. That will happen in probably January or February. This is a first meeting that the Alliance is sponsoring to get feedback from those that are in the proposed annexation boundaries. So it's just a soft feedback meeting so that we get out in front of it before people hear about that annexation or potential annexation. We will have to do an official open community meeting, and that will come thereafter in probably January, February timeframe that the city and the county will sponsor. So we're making progress. Very excited about that.
Super. And Eva, I assure you, you'll be speaking to this group more often because you're a housing innovator. So
60 seconds.
perfect. Thank you.
Really excited to be here with this group. I moved to Durango Thanksgiving. So I'm new to the area with my 2 children who are 5 and 7. We are living right now and renting in the Animas Valley, hoping for more housing stock to purchase something. And my husband is in graphic design and the sign industry. We moved from Frisco, Colorado, and have been in the housing industry, real estate development, workforce housing, attainable housing, and covenants, deed monitoring, working in collaboration and partnerships with different agencies, local, state, and federal. And really excited to be here. I was in Summit County 20 years. So this is a big change for us, but really excited about this community and the position and the role that I'll be playing. So I'm sure I'll get to know more of you in a larger framework.
Thank you so much, Eva. Thanks for relocating. Commissioner Salka.
Yes, thank you, everyone, and thank you, Chuck Stevens, for addressing the Alliance on Land Use Code. I'll make it very quick. Last week, we approved the county budget. Last night, county staff hosted a open town hall managed camp location for neighboring residents as well as the whole community. Heard a lot of input, county staff did, so I look forward to reviewing all of those notes this week. ARPA as well. We have our submittals, people have continued submitting to the county, and on tomorrow we will be, during our board discussion time, discussing the new projects as well as current projects that we have a yes or a maybe on these ideas that have been submitted to the county. So more discussion tomorrow. And then I was going to update as well with the La Posta Road, but we had the city of Durango and Chuck Stevens address that. So thank you all.
Super. Thank you so much, Commissioner Salka.